Over the last 25 years, I've had the privilege of interviewing and highlighting some truly interesting people. Everyone who is anyone, both the famous and the infamous, from presidents and their first ladies to kings and queens, movie stars and pop stars, captains of industry, heads of state, sports personalities, innovative entrepreneurs, and some pretty fascinating everyday people. Today, I am proud to introduce you to Sylvester Ndimele, a public health sanitarian who chose his profession in public health because of his passion for helping others. And Sylvester, I am so grateful for you joining today. I can't wait to find out a little bit more about you. So let's start with the basics. What does a public health sanitarian do?
A public health sanitarians, they are called environmental professionals.
Mhm.
They are specialists in environmental health, and they are also called environmental public health inspector, public health investigator, and they do a wide range of responsibility, which is important in promoting life, health, and the well-being of the public. Part of what they do is they perform sanitary inspection in houses, swimming pools, recreation facilities, and they um, also in schools. So we also conduct prevent and conduct inspection in restaurants, and this is done in order to prevent contamination. You know, and another thing we do is that we also plan for disaster emergencies. We do that too. Um, as a public health sanitarian, what I do is that I do inspection in houses. I work in the childhood lead poison prevention program at Westchester County Department of Health. And what I do is we conduct lead poisoning prevention, prevention, assessment, counseling, and we also do environmental investigation. And the purpose of this is to address every possible sources of lead, because we know how poisonous lead is.
So, sir, as a first generation immigrant, what was your experience like actually coming to the United States?
I would say my experiences has been remarkable. Coming to United States was a great opportunity. It was a miracle for me to come here because I did not plan it, nor did I intend, but the opportunity came, so I took that opportunity, and I'm grateful for the opportunity and excited about the possibility that this country can provide. My first job was in McDonald's. I have my goals, I have my vision, my dreams, but I know that I have to start from somewhere, then from there, go on. So I worked in McDonald's. I worked on the, in the kitchen, the grill,
So did
cashier.
I, Sylvester. My very first job ever was as a fry girl at McDonald's.
So that's
We
why.
have that in common. Absolutely.
So I was living with my uncle. So at that time, and I lived with him for 6 months, and I left him after 6 months. And one of the reasons I left my uncle was I wanted to make decision by myself. I know what I want to do. I want to do everything I need to do, like go back to school and get a second job. I need to be away, to do without any interference. So that's one of the reasons I left my uncle. And after that, I was trying to, because I have a chemistry background. I tried to apply for chemistry job. It was not forthcoming. I said, okay, I think I need to go back to school. So that's why one of the reasons I was looking at something, because I know my passion. I want to help people to be able to relate with other people, educate, counsel. So I said I would go for environmental health. And again, because I have a chemistry background, there is a correlation between both courses. So I did my master's. And immediately I finished my master's program, I have to leave some of my jobs because I wanted to gain that experience in public health. I just went straight to New Jersey, for a 7 weeks program. The internet has been so helpful. And I have information. I have to go in online, search, just for me to educate myself to know how can I be able, to survive and be able to do what I need to do. So I came across this 7 weeks program in New Jersey to become an environmental health specialist, and also to be able to gain that knowledge of what goes on in the health department. When you're hardworking and you're passionate about what you want to do, no matter what you do, you just have to give in your best.
You are so hardworking and industrious, but I have just a little secret to tell you. I found this statistic out when I was doing some research. 1 in 8 workers in America started at McDonald's, just so you know. And that's all the people in the United States who are in the working field. So it is clearly a good place for people to jumpstart their career. And as I listen to you talk, you've held such a wide range of jobs in a number of fields, from public health to retail. But what would you say was the most challenging role for you? What made you learn the most?
I would say working as a public health sanitarian, is one of the challenging, so challenging. So what happened, as I said, I currently work in Westchester County Department of Health in the Childhood Lead Poisoning Prevention Program. And my responsibility is to address every possible sources of lead, because we know lead is very poisonous. I will give a little introduction about, what is lead? Lead is a metal. It is found in the earth's crust. And what happens is that it becomes widespread due to human activity, such as mining and manufacturing. We know before 1978 that lead is added to paint because of its qualities. And most houses are being painted with lead. So any houses that is built before 1978, most of the time, if there has not been any renovation, they always ask, and there's that possibility of finding, lead in that house. So what happened is that when a child is exposed to lead, when a child goes for a blood test, the result, is being sent to the health department, and health department takes it, and investigation is open. According to CDC, there is a level we are looking at, which is 5 microgram, per DL and above. Once the blood test shows that, then an investigation is open. Then the health department takes it up, is referred to a public health sanitarian, whose responsibility it is to reach out to the family, to make the first contact. The first contact is very important, because you are entering into the comfort zone of someone's, home. So you have to be able to make that contact, create that relationship. Very, very important. Now, once you do that, you are trying to make an appointment for an interview and an assessment. So, to be able to investigate, look at the environment, what are the risk factors. And the first thing is we do once we go there, we do the interview session. We ask the parent different questions. What does the child, where does the child play? Access to, does the child put hand in the mouth? So those are the questions we ask, because we know that every child, no amount of lead is safe for a child. Yes. That's what, and the adverse effect of lead is irreversible. And that is why we in the health department takes it very, very serious. We know that lead affects the mental and the physical development of a child. We know low IQ, it delays puberty, hearing loss, anemia, kidney damage, and it can also result to death depending on the level. So that is why we take it very, very serious, because children are still developing, they're still growing. It also affects their learning, affect the central nervous system and affect their learning ability. So that is why it's very, very serious. And in adult, it also affects an adult too. And what it can cause high blood pressure. It can result into abnormal, sperm count, or premature death in pregnant women or stillbirth, and it can also cause joint and muscle pain, headache. So those are or loss of memory or concentration. So those are the effects of lead. So in the local government or the local health department have to determine, how they want to enforce, when it comes to lead, how they want to go about, with the process. So it's very, very important to look at the community as a whole. So what happens is that after we receive the scope of plan of what they want to do, what they will do, how they want to do, there are different methods in order to correct when it comes to lead. If it's found on the wall, they can either use sheetrock, or if they want to use encapsulation. So it depends on the contractor of what they want to do, and they will send the notice to us. Then if I conduct the inspection, I have to review the scope of work to make sure that everything they're going to do is according to, what is acceptable.
Tell me, what unique skills do you bring to your role as a sanitarian?
One of the unique skills I bring is effective communication. You must be able to communicate very well with family. Everybody is different. There's some that speak Spanish. Yeah, you have to find a way to relate with them. Some people are more educated. They speak limited English, but at the same time, you have a job to do, and you still have to be able to communicate with them in the language that they understand. Sometimes you have to speak to them, in simple English for them to be able to understand what you're trying to pass across to them. Effective communication, then strong ethics is very important. You must be being organized, time management, because there's a lot to do. So you must be able to manage your time very well and be able to accomplish, what you still want to do. Another thing is writing skills. Very, very important, because you have to put down your report and everything, because with time you can still refer back to them. It is very, very very, very necessary.
So I know you grew up on a farm in Nigeria. What was that experience like? And please tell me, how did it shape you professionally, since we've been talking about you professionally?
Yes, growing on the farm in Nigeria has been unique, because I grew up on the farm. I spent more than 15 years on the farm. Because I was the oldest, so I was much more responsible responsible to manage, what goes on the farm. The farming business, there is no tractor. We have to do everything with cutlass, hoe, and everything. So another aspect is that there's no time to procrastinate. There's work to do. There's no time to complain. So you just have to you just have to go to the farm, do what you want to do. And it depends on what you put in is what you are going to receive. If you don't weed and you don't have fertilizer, you don't water or irrigate, then you are not going to get a very good product. And those things shape the way I see, I see things, I handle life, not being hardworking, and help me to be more creative. Because if you're working on the farm, you don't have just one way. You have to keep switching things around in order to get a good product.
Sylvester, speaking of time, do you have time to, outside of work, do community service and participate with your community?
Currently, though I work as a public health sanitarian, I work with people with special needs.
Oh, that's nice.
Yes, I do that. That was my first job, but I didn't leave there because I found a purpose in helping them, to support them. So I work with people with special needs. So that is one area that I really been investing in.
Wonderful, wonderful. So as we come to a conclusion, I'd love to know, what are your goals for the future?
I think before I go over there, some of those things that I do within the community, you understand, is that I try, and as I said, that I love to help people. I have assisted so many people when it comes to financially, So what happens that there are people who their rent is due, I have to help them to pay 6-month due, just to assist them. I've assisted more than 6 individuals. They were about to get married and they need financial assistance. And to get married, you need that resources. So I have to, go out of my way, and see what I can help them and assisted them. And another thing I do was, during the height of the pandemic, I bought food and I gave to the church, to a particular church. I also bought food and I gave to a local community action group. So those are some of the ways by which I have invested in the community. For the future, I would say that I want to be an educator, you understand? And I want to go for my PhD, either in public health, and I'm still open, to other areas, depending on what is going on in the environment. So those are the other things. But one thing I will say, I have my goals, I have my vision, I have my dream. But I know one thing, that the future belongs unto God. At times we have plans, we have everything. At times things have to change. So I just have to trust God for what the future holds for me.
Excellent. Excellent. And Sylvester, finally, what's the one thing you'd like the viewer of this video feature to walk away with today?
One thing I would say that whatever you do it with all your might. And whatever you do, try to do it very well. I would say don't lose hope. It is never too late or too old to achieve your dreams.
What a wonderful sentiment that is indeed. Sylvester, it's been wonderful getting to know you and to find out more about your passion. I wish you the very best with your career and what's next. Thank you, sir.
Thank you very much.